but some people wonder what is Neisseria gonorrhoeae, what diseases it causes, and what kind of infection it gives to the human body. Now, we give to you Neisseria tablada that will briefly explain to us what is Neisseria gonorrhoeae.
We're gonna talk about Neisseria gonorrhoeae. Neisseria gonorrhoeae, it is a gram-positive cocci, non-spore-forming, non-encapsulated, and non-motile. Neisseria gonorrhoeae there are a major virulence factor. The first one is the pili, mediate attachment, cause phase variation, and antigen variation. Antigen variation is the lack of immunity. The second one is the pore protein, prevention of phagolysosomal fusion. The third one is loss or endotoxin, and the fourth one is IgA protease. Its epidemiology. Humans are the only host. Second most sexually transmitted disease, higher in adolescents. Asymptomatic carriage is women greater than men. Now, I will discuss the different types of diseases that caused by Neisseria gonorrhoeae aside from gonorrhea. Urethritis in men, PID or pelvic inflammatory disease in women, and for newborn, ophthalmia neonatorum. Sites are urethra and vagina. In men, urethritis. In women, inflammation. Show you some pictures of diseases caused by Neisseria gonorrhoeae. This one is pharyngitis. Second one is ophthalmia neonatorum for newborn. The third one, sites of the body infected by Neisseria gonorrhoeae. Anus or rectum, which is called proctitis. Throat, which is called pharyngitis. Joints, which is called arthritis, especially in young sexually active persons. Erica Jane M. Ritos, who will interview a medical doctor regarding Neisseria gonorrhoeae.
Now, we will interview a professional medical doctor regarding Neisseria gonorrhoeae. She will give us some information regarding the disease causes. Now, she graduated on St. Louis University, has a degree on PS Biology, and took the specialization in pediatrician. I now introduce to you Miss Maria Isabel M. Ritos.
Gonorrhea is caused by a bacteria known as Neisseria gonorrhoeae, found in the vaginal fluids and semen of men and women who are infected with the disease. The symptoms in men, there is usually burning sensation while urinating. There is frequency and urgency of urination, and there is a yellow pus-like discharge from the tip of the penis. While in women, basically the same, they also experience painful and burning urination. There is vaginal discharge, and there is usually irritation. Usually there are various antibiotics which can be given for gonococcal disease, such as third generation cephalosporins, example is ceftriaxone, also macrolides like azithromycin, and other antibiotics like doxycycline. While in pregnant women who acquire the gonococcal disease, you may give tetracycline. Also for the unborn child, for pregnant women who are infected with the disease, usually they are given Creed's prophylaxis in the uterus.
Okay, what advices can you give for the patient who has this kind of disease?
For the sexually active patients, they should practice safe by using protective devices such as condom. And if they can practice also safe sex by having only be faithful to your partners, and as much as possible do not have multiple sex partners. And if you already have the symptoms, go to your doctor for treatment and management and other advice.
We now have heard the information given by Dr. Maria Isabel M. Ritos regarding Neisseria gonorrhoeae. I hope the information she provided you would help you to understand it. Back to you, Ms. Renee Pagada.
Thank you, Ms. Erica Ritos. Laboratory diagnosis of Neisseria gonorrhoeae, gram stain of urethral discharge, culture Thayer Martin agar, glucose, maltose, and sucrose test, DNA proof. Like what Dr. Ritos said about the treatment and prevention, intake of ceftriaxone, mixing of infection with chlamydia trachomitis, add tetracycline, prevention, use condoms, and avoid having sexual intercourse with multiple people. We hope the information we provided you had helped you to understand Neisseria gonorrhoeae. We have a commercial and we will be right back.
Wait guys, I have something to open up.
What?
I have a problem about how can I and my boyfriend prevent on having a disease when we do it. Abstain from sex. And
If I were you, I would to use condom.
condoms?
Yes. It's effective in preventing a disease when having a sexual intercourse.
Wow.
Wow!
Oh yeah, thank you for that advice. Well guys, I have to go now.
Bye! Bye!